Hi, this is Francesca Cottini. I'm an assistant professor in the Division of Hematology at The Ohio State University, and I focus on multiple myeloma. Today, I'm going to talk a little bit about our new data on the rate, prevalence, and risk of CMV reactivation after treatment with biospecific antibodies such as Teclistamab. Teclistamab is one of the newest biospecific antibodies approved for the treatment of patients with multiple myeloma after at least 4 lines of prior therapy. It targets BCMA and it has shown very good overall response rate for our patient with relapsed refractory disease. More and more we use this medication, we have seen that it increases the risk of any type of infection, especially upper respiratory tract infection, viral infection, and pneumonias. And for that reason, most of the patients are receiving some type of antimicrobial prophylaxis. Usually they take antiviral medication to prevent the risk of shingles or herpes infection. And they also take something called Bactrim, for instance, to prevent PJP pneumonias. What we have seen is that CMV, which is a very common virus that most of the people get exposed when they are young, when they are kids, can also reactivate. This is a type of opportunistic infection. And we look at our patient treated with Teclistamab, and we were checking CMV viral load, because CMV can be latent in your body and then can reactivate and goes to the blood and to different organs, causing symptoms and signs. And we saw that looking at 23 patients, consequent patients, half of them had some type of CMV reactivation. And when the CMV PCR level, the CMV anemia in the blood is very high, it can cause some type of symptoms, can cause abnormal liver function, can lower your platelets, your white count, can also go to different organs and cause, for instance, diarrhea, something called CMV colitis, or can affect the lungs. CMV reactivation is very common, especially in patients post-allogeneic stem cell transplant. And usually if the levels are high, as the one that we saw in some of the patients, you require some type of treatment. Our patient with CMV, the anemia reactivation, had symptoms, had colitis, one of them, and we were able to treat them with some specific antiviral therapy called ganciclovir. And all of these patients were able to remain on therapy with Teclistamab and still have ongoing response. We also saw that patients who had the CMV anemia also were more prone to other type of infection, viral infection, bacterial infection, and fungal infection. And their duration of response to Teclistamab tend to be a little bit shorter, even though our casuistic was only 23 patients. So overall, I think that our data start to show that also CMV reactivation can occur with biospecific antibodies, and we are actively monitoring every patient that received Teclistamab to make sure they don't reactivate their CMV, and in case they do, we can treat proactively. Future studies are really try to see how much this is impacting the prognosis, the function, and the effectiveness of Teclistamab, and we are working with other group from the Big 10 institution to kind of enlarge our casuistics and have a bigger number of patients involved.